All right, everyone, we're going to get started. I want to kick us off by just reminding everyone that in order to preserve confidentiality, we do have a few simple ground rules we want to keep you all aware of. First, we're no longer going to allow AI note taker programs to join the webinar. If we see them and maybe they've accidentally joined, they're going to get removed, but you will get access to this as a video recording. And if you need the captions, you can also turn closed captions on. If you see someone in the webinar that you know, please don't call them out publicly in the group chat. Save that for the after party or send them a text to say hello instead. And then finally, we will be recording the question and answer portion for tonight. We're noticing that you all have such great and valuable questions that we want to make sure those who can't join live can still benefit from those. So because of that, I will invite you that if you're not comfortable having your video recorded when you're asking a question, feel free to stay off camera if that's what you prefer, or just send me your question via the chat or in a direct message, and I'll be able to read that out without people being able to identify you on the video later. So with that being said, let's dive in. Okay, so my name is Emily Whelden. I am a team coach here at Dixon Life Coaching. I'm formerly an attorney, and I primarily work with lawyers and people with chronic illnesses in addition to ADHD. At Dixon Life Coaching, we're the premier coaching firm for high achievers with ADHD, and we work with our clients to help move them from a state of stuck to a state of thriving. So today, we're going to be talking about chronic health conditions and ADHD. So very quickly, I'm going to do this run through on why this is such a big problem, first off. Then we'll talk more about what we can do about it. So really the big concern with ADHD is that it impacts your life expectancy. And Russell Barkley has been doing a lot of research on this for many years, and his research indicates that ADHD affects your physical health in the same way that it affects the rest of your mental health. So some things that we know about ADHD and health, or rather we might know that the research is suggesting, even if hesitantly. So we know that if ADHD persists into adulthood, the reduction in life expectancy is between 12 and 13 years. So this is for children who are diagnosed with ADHD. We also know that it costs more to take care of your health when you have ADHD. So in ADHD, medical costs are higher compared to our non-ADHD peers. A lot of this is due to accidental injury. We're more likely to make impulsive decisions and get hurt because of it. But also what we see in the coaching world, and as demonstrated by our clients and other real people, that at least a significant proportion of this is attributable to ADHD and our poor health outcomes. So particularly our susceptibility to chronic illnesses. Okay, so one of the reasons this one of the reasons this happens is because of unhealthy behaviors. So Dr. Barkley found that people with ADHD are more likely to drink alcohol in excess, smoke, we're more likely to gain weight, to not exercise, and sleep poorly. And so these behaviors can lead to preventable chronic illnesses like obesity, heart conditions, diabetes, and some cancers. So this is where the double whammy comes in the first time. And this sounds pretty bleak, but ADHD can create the conditions that lead to or exacerbate chronic illness, and chronic illness can create conditions that exacerbate ADHD symptoms. Yikes. There is some good news though, and that's that treatment improves your outcomes. So for all of the variables that Dr. Barkley found, which were reducing life expectancy, those can be changed, those can be modified. So all of those behavioral things that impact your health can be reduced. The impact of those can be reduced. So the double whammy, you might have that double whammy impact, but luckily treating it is also a double whammy. So treating chronic illness can create conditions that alleviate your ADHD symptoms, and conversely, treating ADHD can create conditions that help avoid or reduce the effects of chronic illness. So the key thing here is that we need to be treating ADHD from the primary care level, or we need to be thinking about ADHD from the primary care level in the way that it affects our overall health. I'm going to super breeze through some of these next slides so that we can keep this discussion today mostly focused on what you can do to help support yourself. But a lot of research has been coming out over the last several years that indicates that people with ADHD are at increased risk, not just because of those behavioral conditions, but also that it's indicating there may be a correlation in terms of genetics, right? So we struggle to adhere to clinical therapies. We have a higher rate of health risk-taking behaviors, and we have a lower rate of health protective behaviors. But then there's also some really strong evidence about comorbidities, specifically in cardiac conditions and later dementia type conditions. So how does ADHD impact your chronic illness and vice versa? Well, one thing is that your chronic illness may lead to a delayed ADHD diagnosis. And I have this as a personal example. So first, you may misattribute symptoms, and your symptoms may be masking factors that lead to missed ADHD diagnoses. So as a personal example, I was tested for ADHD when I was a child, when I was 7 years old in first grade. However, I was also suffering with other health conditions, namely migraine and epilepsy. And I was taking medications for those that are used to treat ADHD in people who cannot tolerate stimulants. And so these were making it really difficult to determine whether my focus and attention challenges were ADHD or whether they were epilepsy and migraine. Turns out probably both, but that's a side note. So this is a real challenge, though, because a missed ADHD diagnosis means fewer and less effective executive function coping mechanisms, right? If you're diagnosed with ADHD earlier, you're more likely to get early intervention and have healthier self-supportive coping mechanisms and skills. And if you're diagnosed later, you're less likely to have gotten that additional support. So this is another way that the double whammy comes in, because executive functioning skills are inherently necessary for management of chronic illness, but we don't have very good ones. So this is going to lead to less favorable health outcomes for the chronic illnesses and also for ADHD than someone who only has a chronic illness. Okay, so how can ADHD lead to delayed diagnosis of chronic illness? So your ADHD this is the converse. This previous slide here is how chronic illness can lead to delayed ADHD diagnosis. Now we're going to talk about how ADHD can lead to delayed health diagnoses. So ADHD symptoms can also mask chronic illness in the way that I described my chronic illness masking my ADHD symptoms earlier. So firstly, poor self-awareness of symptoms. People with ADHD really struggle to remember their symptoms and to accurately, or maybe even accurately not accurately experience, but identify what their symptoms are, their physical health symptoms. So you might have really poor self-awareness, and this might come out, or this might show up like, I was so busy today that I forgot to eat until I was shaking, right? Maybe this person has a blood sugar condition and they're really low blood sugar, and that's dangerous for them. But the reality is they didn't just forget, right? That self-assessment is pushed aside in favor of more quote unquote important things due to difficulty with prioritization, for one, and also interoception. And interoception is your ability to sense what your body is doing, how it's working, how it's, are you hungry? Are you thirsty? Are you tired? What does your body need? That sense is stifled when you have ADHD. The second way that ADHD masks chronic illness symptoms is that poor working memory impacts symptom reporting. So I had a client who she was saying, my symptoms really haven't been that bad lately, but she was in my group coaching program and she had been posting check-ins every day, talking about how horribly she was feeling and how she couldn't get out of bed and how she was trying to work from her laptop in her pajamas and was really struggling through that. And so the reality was that her symptoms had been interfering, but because they weren't happening right now, she forgot about them. The other thing that ADHD can mask is through affect. I have hyperactive speech, right? I like to joke that I speak on 1.5 speed, and I really do. But when I show up to a doctor's appointment like this, or like my client I was just describing earlier, when she shows up, she's super bubbly and so excited for her appointment, and she's, really jazzed and ready to go. She does not look like she's on a 10 out of 10 for the pain scale, and yet she is, and objectively is. And so hyperactivity expressing as excessive talking and excitement can also hide the fact that you're really sick. Finally, emotional dysregulation. Oh man, we all have a doctor that they've said something a certain way or something, and you've maybe felt a little like that I'm angry now, and I'm going to be angry at this person. And this comes across sometimes as you're just being difficult, or you're that patient that we don't want to work with, right? When in reality, minor frustrations are real major roadblocks for many of us. And emotional dysregulation can lead to doctors and healthcare providers dismissing what we're saying because they're not capable of hearing it in the way that we are currently expressing it, whether our way of expressing it is effective or not. Okay, so managing your health requires effective use of your executive functions. I'm not going to go through these all right now. You'll get the recording. If you want, you can pause to read. I'm going to quickly skim through them. So some executive functions that you might use for managing your health are activation, working memory, emotional control, planning, inhibition, second slide of this, impulse control, self-monitoring, effort, focus, and organizing. So this might look like medication compliance or adherence, remembering to refill your prescriptions, right? Scheduling appointments, showing up to appointments on time, filling out paperwork or forms, all of these things. And these are inherently difficult when you have ADHD, right? Inherently difficult. So there's also executive functioning dual impacts. I've got a handy little graphic. So when your ADHD symptoms increase, your executive functioning decreases, right? Because ADHD is an executive functioning disorder. So the more your ADHD is raging, the harder you're going to have managing your executive functioning. Funny enough, chronic illness symptoms also increase, or an increase in chronic illness symptoms also decreases your executive functioning. And so when their powers combine, you get a third double whammy, right? This is why it's so hard when you have ADHD and chronic illness, why it's harder to manage your executive functions than if you just had chronic illness or you just had ADHD, because they amplify one another. So I'm going to skim through this. If you don't know what spoon theory is, it's a way to describe how people with chronic illnesses have to manage their energy. And it's based on the premise that energy is finite and must be rationed throughout the day. So this applies specifically to people with chronic illness and ADHD because executive functioning requires cognitive energy, which is still energy. So this forces a trade-off between physical tasks and executive functioning tasks. So a key takeaway here is that energy is finite, and people with chronic illness and ADHD have greater demands on their energy than someone without a dual diagnosis. So what can individuals do to mitigate the double whammy? First, early diagnosis and treatment. Seeking help from your physician, from mental health care providers, and from coaches. When in the context of ADHD management, you can ask your doctor to provide you, their patient, with the skills needed to manage health challenges proactively, right? What do I need to know about ADHD and this? Physical health conditions can also be impacted. So your doctors who are managing your physical health conditions, they might need to know how ADHD impacts your physical health in addition to your physical health conditions. And then overlapping impacts. So some treatments like exercise improve outcomes for both ADHD and other health conditions. This also includes things like sensory overstimulation. For example, I get super sensitive to light from my migraine disease. I also have sensory processing when it comes to visual stimuli. And so I, like, if I'm going to the grocery store, need to wear a baseball cap, both for the overhead lights, but then also I just sort of like cocoon myself in my baseball cap and I don't get distracted by all the things around me. Some practical strategies. And then once we get through these, we'll go with questions. So tracking and health journaling. These are really key for people who are managing new health conditions, but also if you haven't really been managing your health with intentionality, tracking and health journaling can be really effective. They are a great working memory aid. They help combat disassociation. Disassociation is common in people with chronic health conditions because oftentimes it is too emotionally draining to think about how we're feeling. So this is a protective coping mechanism that we accidentally fall into. But it also makes it more difficult for patients and providers to have an accurate understanding of the symptoms and the symptoms impact. So if you can use tracking or health journaling in a more objective way, you don't have to be feeling in your body in every moment, but you can check in with your body and see how it's doing throughout the day as you're tracking in a more objective way. This increases or improves communication with your providers, and it helps capture strategies or treatments that are working and gives you good info on ones that aren't. Second practical strategy, self-advocacy. I know, such a revolutionary concept here. But one of the biggest things that you can do as an individual is educate your providers about lesser known symptoms of ADHD, or conversely, educate your ADHD providers on your physical health conditions and how these impact you. So this is a very fine line for some providers, right? Some providers do not think that patients, or rather, they give off the impression that they know better than the patient because they went to medical school, right? This is the don't mistake your Google search with my medical degree. And the converse to that is I am the one living in my body, right? And so I am the expert on my body, and you are also the expert on your body. What you need to balance is, who is the person I'm talking to? Are they receptive to hearing what I'm saying? And frankly, if they're not, maybe trying to find another provider, which can be really challenging, but sometimes it's the most effective thing you can do. When you have a niche or a more specialized health condition, and you have a specialist that you go see, for example, asking that specialist provider how you can effectively communicate with your other providers who may not be as familiar. So this specialist could be your psychiatrist around ADHD, but it could also be the person who treats your rare disease or your diabetes doctor or whoever. And then finally, make sure you're asking about the side effects of medication and the potential impact on other health conditions. Very early in the pandemic, I had to go off of Adderall immediately. not because of a shortage, but because of a cardiac condition was flaring. I knew that on day 5, I was going to be fully off Adderall. It was going to be fully out of my system at that point. And I knew that because my psychiatrist told me. He was like, look, day 5 is not going to be your day. Day 3 and 4 are also going to be not so fun either. And so I was able to reduce the impact of that on my life. I wasn't able to prevent a migraine, but I was able to move appointments or to change what I planned to do for the day in order to accommodate an increase in my need to rest and take care of myself. So how can a coach help you with this? Well, one of the things coaches do is they help empower you to advocate for yourself with providers. And that can look like maybe thinking through how a conversation is going to go, or working through how to explain a challenge that you're having in a way that is clear and gets your point across, but doesn't make the other person feel like they're not the doctor. I know that's that fine line. A coach can help you figure out where that line is. We can also help you confront negative internal narratives. We can help you prepare for medical appointments, either through organizing your information or documents, or helping you fill out forms, even if that's just sitting there while you fill out the form. As a body double, a coach can be a really great asset in that regard. We can also help you work through organizational tasks and executive function barriers. And we can help with behavioral change relating to health barriers. I am trained as a health coach, not as a, I am trained as an ADHD coach, but my primary coach training is through health coaching. So I know a lot about how to work through barriers to physical health behavior change. And we can also help with mindset issues. So magical thinking, like ignoring your limitations, or working, we can be that external memory, right? That client who was like, I've been feeling great. And we can also help connect the dots. So at this point, I'm going to quickly tell you about 2 resources we have available for you, and then we'll switch into questions. So Focused Health ADHD, our group coaching program, this is coming up at the end of the month. It's a 4-week group coaching workshop that deals with the intersection of ADHD and chronic illness. None of the stuff that we talked about today will be covered in it. So it's all brand new material if you're interested in that. And you can sign up for that on our website at this link, or if you go to our homepage, it's under group coaching programs. We also have a free guide for you today, and this will be going out, I believe, in the email. Correct me if I'm wrong, Christine. But this is a workbook all about how to organize your health information and how to stay a little bit more organized when you have ADHD and a chronic illness. If you're looking for real fundamentals, we also have our Livable ADHD e-course, and that is all. So now I'm going to stop screen sharing and we'll do questions. Does anyone have questions? I know I spoke very fast. No questions. Can I elaborate on spoon theory? Yes. So I used to have a little exercise in this presentation, but essentially the way the story goes that Christine Messandrino said, she has lupus, and she was out at a diner with her friend who had been really helpful and instrumental in helping her work through managing. I think she was a sophomore or junior in college, and she was just getting diagnosed with lupus. And her friend asked her, what is it like to have lupus? And Christine Messandrino tells it as like, what do you mean? What's it like to have lupus? You've been taking me to the doctors. You've been taking me to the hospital at all hours of night. You've seen me at my sickest. And her friend said, no, really, what is it like? And so she took all of the spoons from all the tables all around her, all the utensils, and she gave her friend a certain number of spoons. I think it was like 10, and said, okay, each thing you're going to do today counts as a spoon or 2 spoons or 3 spoons, however much it is, right? So taking a shower, that's 1 spoon. Writing a complicated email, that's 2 spoons, right? And so you have to decide all day, every day, how you are going to dole out your spoons, what you're going to use energy on. And that takes itself a lot of energy. So the idea of spoon theory is that it's a way to quantify or to conceptualize this concept of energy management, how to choose what to spend energy on and what to skip. Does that answer your question, Angela? Yeah, great. And the funny thing about spoon theory is also that you can regain energy by doing health protective behaviors, right? Going to sleep at a certain time or getting enough sleep, drinking enough water, eating lunch throughout the day, that sort of thing. But many people with chronic illnesses don't regain energy at the same rate that their peers without chronic illness do. So it also represents sort of a recovery delay and a reduction in overall capacity. And the thing about that with ADHD is that your brain also uses spoons. So thinking and executive functioning tasks, those take up spoons also. Any other questions? I have fibromyalgia and ADHD, and I'm always exhausted on weekends. Any suggestions? So I would say that you are likely running an energy deficit during the week, right? You're pushing through, working really hard to get through the week. And sometimes that's necessary, but a key thing that I teach in my focused health group is how do you know when you're pushing yourself too far? How do you figure out where you can streamline or diminish the complexity of some things so that you're not using as much energy during the week on those types of things? So that's one of the things that I talk about during my course or my group rather. But one of the biggest things, everybody always has to figure out how to eat. What am I going to eat today? Who's going to cook it? What's going to happen? To the extent that you can automate or take those decisions for yourself out, you're going to be saving energy. And that could be as simple as just deciding to have the same breakfast every day, right? And buying enough of it on the weekend so that you don't have to think about and you don't have to prepare it during the week. My husband and I eat a lot of bagged salad, right? Because it's super healthy, but it's also very low effort in terms of planning and energy. And, with a little bit of chicken, it's a perfectly balanced meal for us. So that's the kind of thing where I mean, like diminishing and streamlining your organizational and executive functioning load outside of work, outside of your healthcare, so that you can really save as much of your energy as possible for being in your body. Not a question, but I went to my annual physical and got a printout of everything, quote unquote, which it was not. And then got barraged from specialist to schedule, which in some ways was helpful and other ways overwhelming. So I'm hearing that the it was overwhelming to have all of these things happening at once, but it may have been helpful to have somebody else be doing the follow-up for you. And that's a lot where a lot of people, or I have one specific client I'm thinking of, she is a concierge doctor. She's a lawyer. She has a connective tissue disorder, and she also has 2 kids, and she, works full-time. She's got a lot on her plate. She has her PCP as one of those very fancy concierge doctors, and her concierge doctor's office will call and schedule sometimes her appointments for her, or will say, oh, we've already done this test 6 months ago. Do you need her to repeat it? And so her primary care doctor can really coordinate care with her various specialists so that she's not duplicating things, and so that she's getting the most what's the most impact from the doctor's appointments that she does have to go to. Yes, it can be very overwhelming. Any other questions or comments? Do you help with insurance claims? To the extent that that is an administrative task that a client needs help getting through, if I were working individually with them, we would generate a strategy around, we would think about what's getting in the way of doing them. Usually it's because they're boring. Maybe we think about ways to respond to what's getting in the way. And then if they did need that, yeah, sometimes I will sit there and do body double sessions with clients as they fill things out or talk through things. But we as an organization don't submit reimbursements. Like, we don't do that for you. If that makes sense. Like, we wouldn't be filling out the form yourself, but if you need a body double to sit with you while you're filling out the form, I will do that while I'm responding to emails. Okay. Any other questions? Okay. All right. I'm going to post in the chat the link. Oh, if I can get to the link. The link to the My Health cheat sheet and to our what's the word I'm looking for? Focused health group. So that's the cheat sheet. And our focused health group is on this page. One moment.
This is Christine, everyone. I'm kind of the behind the scenes at Dixon Life Coaching, but I'll just let you all know that these links will also go out in a follow-up email that also has the link to watch the webinar if you missed any part of it.
Thank you so much, Christine. With that, do we have any other questions before we sign off? I want to be respectful of everyone's time, and we're at 6:36 already. Okay, I'm not seeing any others. If you have any, feel free to use the react button, and I will I'll keep everything going for a little while. Okay. All right, everyone, I want to thank you so much for coming, and thank you for your questions. I hope this was helpful, and hopefully we'll see you at future programs.